Welcome everyone to this Leading Health Systems LHSN webinar focused on the impact of COVID-19 on cybersecurity in healthcare. Just as a very quick introduction, the LHSN is a collaborative network of healthcare leaders and organizations dedicated to improving healthcare delivery within the Institute of Global Health Innovation at Imperial College London. Today, I'm very pleased that we're hosting Richard Harrison, who will be presenting the session entitled Balancing Cybersecurity Outcomes with Clinical Outcomes During COVID-19 Pandemic Emergency Response and Where to Now. Richard is an award-winning cybersecurity leader and is Chief Information Security Officer at Health Alliance in New Zealand, building and implementing an information security transformation strategy and program designed to embed robust and effective governance over cybersecurity and risk and develop the capabilities required to effectively implement security controls. So he's very well placed to talk with us today about the impact on healthcare. The format of today's session will be a 30-minute presentation followed by 15 minutes of questions. So can I ask that you all ensure your camera's turned off, your microphone is muted, and if you have any questions you'd like to ask Richard that come up through the session, please type them into the question box to me, Nikki O'Brien, via the messaging feature on Zoom. So with all that said, I'm very pleased to hand over to Richard to begin the webinar.
Thank you, Nikki, and good evening, everybody from New Zealand. It's the evening here. So I'm going to present this evening. The presentation's got sort of three main parts to it. In the first section, I'm going to give a brief overview of how we responded to the pandemic from a technology perspective here in the northern region of New Zealand. And what we achieved in that time, including a brief insight into the approach we took from a security point of view during that response. Then I'm going to take a look towards the future in terms of emerging risk drivers for increased cybersecurity risk in a kind of post-pandemic world. And then I'm going to finish by outlining what you can do to minimize the risks and increase resilience by providing you with some insight into how we're approaching cybersecurity here in the northern region of New Zealand. So first of all, I'm the Chief Information Security Officer for Health Alliance, as Nikki said. And Health Alliance is a wholly owned subsidiary company of the 4 district health boards that make up the northern region in New Zealand. There are 3 district health boards in Metro Auckland area. Waitemata, who are the LHSN members in this case, Counties Manukau and Auckland District Health Board. And the other is Northland District Health Board, which covers the area to the north and the far north of New Zealand. We've probably got the largest and most complex IT infrastructure and services in the country, and possibly one of the largest within the Oceania area. So in that context, healthcare is critical national infrastructure and needs to be treated and protected as such. The consequences for the region and for the country, in the event of, say, a major successful cyber attack would actually be quite severe. I think the number 38% of the population, when I did this slide originally, is probably over 40% now of the New Zealand population live within this region, which is about 1.82 million people. So what I'm going to give you now is an overview of what the region did from a technology perspective during the period sort of early March to early May. These are extracts from a much fuller report. Then I'll give an overview of how we managed that response from a security perspective. So to put this into a context, the clinical and organizational pandemic response is managed under the New Zealand Coordinated Incident Management System. That's a nationally coordinated incident response system that governs how New Zealand public agencies should coordinate and establish command and control to provide incident response on any scale. And that would have been the model used for example, in the Christchurch earthquake in 2011, or the mosque shootings in 2019, to a greater or lesser extent, very localized response, but the same framework. And that framework sets out how the response is structured, governed, and led, and describes the relationships between the respective agencies and between the levels of response. So in this case, we had 4 levels of response. Level 4 was total lockdown, and level 1 equals sort of situation normal in most areas, but and that's the level that we're at now. The only main difference to normal sort of ways of life is that we've got very strict border controls in place. Now, each of the district health boards established an incident management team, and that fed into a Northern Region Health Command Centre to coordinate things across the region. Early on, it was very, very clinically focused and was looking at individual patient cases and really excluded the direct involvement of technology specialists. But that changed very rapidly as the daily situation changed. I was a member of the Health Alliance incident management team that oversaw how our own company response was managed, as well as the response to the technology demand that came in through the district health boards. I was providing a sort of a cyber status update to our executive and the IMT, setting out any actions or approvals required from executive leadership. And we met daily, really, from early March through to Easter, roughly, and then probably 3 times a week thereafter. The IMT is still running, but the main focus now is on recovery and workforce planning as we sort of shift to new models and new ways of working, as well as supporting the emerging border control technology requirements, which we're working on this very week. So as part of that technology response, a very high level response plan was developed with some very key areas to prioritize and deliverables that would set the region up for responding to the pandemic. Now, as we know, the number of cases in New Zealand was low in the end, but early on there was no way we could predict what was going to happen, and so we basically planned for the worst and hoped for the best. The key focus areas were really remote working expansion. One of the strategies of the DHBs was to get as many non-clinical staff off-site as possible to minimize risk of infection and therefore impact to operations. Managing the actual technological response to the pandemic itself, testing facilities, telehealth capabilities, the tracking of results were all key priorities. And on top of that, we had sort of operating the hospital, expanding essential services, and also improving processes to try and be faster and more efficient in our response. And this is where we had got to by around about the 7th of May. We'd achieved the massive expansion of network capacity, a huge expansion in remote working, more than doubled the number of active user sessions on our sort of Citrix farms, really accelerated the adoption of Zoom and Teams, scaled the service desk. The pivot to remote working had a major impact on service desk operations, establishing remote access, enabling new devices that all generated very significant demand. By mid-May, we were reducing from level 4 to 3 and mid-June to level 2. And we're now, as I say, at level 1, which is pretty well life back to normal, but border controls in place. Very early on, we established some of the coordination centers. So the Health Command Center, we had to set up very quickly, devices, screens, Wi-Fi, network access, access to applications, data visualization, and so on, to enable the coordination of the response across the region. So there were two operation centres, one in Auckland and one in the northern part of the region in Whangarei, which is sort of at the heart of the Northland District Health Board. That's actually where I live. Community-based assessment centres were all set up from scratch, kitted out with mobile technology solutions to give access to patient management systems and testing laboratories. Some of these are actually still operational for the time being, although there's some scaling back. I think we're just waiting to see how well the border controls work and make sure that we don't get community-based infection. A big component of what we did was around telehealth. Obviously, the ability to avoid face-to-face contact, it was pretty crucial, not only because of the infection risk, but also because of the travel restrictions that were in place. In a region that's geographically dispersed as ours is, where you've got some quite remote communities, the ability to sort of have Zoom sessions, appointments with patients was quite important, and I would say this is probably the biggest shift in the clinical response that will be maintained as we go forward. Of course, while all that was going on, we had the Zoom security issues to deal with, most of which were mainly around trying to calm people's fears. The main concern was sort of Zoom bombing, but that was actually really a phenomena which affected the public free version. If you had the corporate version, there were things you could do and controls you could put in place to minimize the risk of that happening. And these are the sort of other things that we set up for, in this case, ADHB and Auckland DHB and Counties Manukau DHB in Auckland, in the telehealth space. So the key principle really was to try and expand and transform at pace, while maintaining the service continuity of hospitals. And I think the success really was founded on our ability to establish the capability to operate remotely very early on. And we were managing our IT systems remotely pretty early on, utilizing and scaling existing technology so we could support that home working. And I think another key thing that probably underestimated is people unifying behind that goal of defeating the virus and becoming part of the team of 5 million, as the Prime Minister liked to call it. Engaging with suppliers, getting them into the supply chain and making sure that we knew what they needed to prioritize and when. And I think it was just a huge sort of team effort across the region to overcome those challenges. I mean, the demand that came in was quite significant. We had over 700 bits of demand that we had to deal with in a very short, compressed space of time, under very extenuating circumstances. So that kind of deals with the technology response, and then how security fitted into that. So all of that technology demand was funneled into a dedicated sort of COVID stream, with a program manager across the top of it. The program manager was assigning pieces of work to various multidisciplinary teams that were and resources that were set up to respond. There were daily stand-ups to allocate those new pieces of work and track the progress, deal with issues and blockages. Initially, it was quite tactical, and there was a bit of chaos that reigned for a week or two as the regional structures were established and coordination got better and control got better. I assigned a security specialist to this group, and they managed the demand from a security perspective. So he assigned work to other members of the security team as required as it came through. So that might have been, I need a security specialist to input to this design. I need a risk analyst to do a risk assessment here. I need a penetration tester to help with this particular solution here. And that way we were channeling our own demand on a daily basis as well. As a team, we established a bit of a unifying identity for the security and risk team. It's partly a bit of a bit of humour and partly to try and unite everyone really in the mission. We organised as a team very early on, and we're one of the first Health Alliance teams to go fully remote before the full lockdown came in early March. We established Microsoft Teams as our go-to app for chat and collaboration, and we use Zoom for video conferencing across the team. We had daily team stand-ups at the end of each day to see what was happening, who needed help, where we might need to escalate any risks, and to stop some, dumb stuff from happening. But that was also designed as a bit of a valve for emotional release and trying to maintain the sanity of the team, and also some social contact. It became quite clear early on, not just within the security team, but across the whole organization, that mental health in such stressful situations is actually quite important. Not only the stresses of work, but maybe you've got family health issues that people are going to be worried about. What if I've got a vulnerable family member who might get infected? What happens then? Or concerned about loved one losing their jobs because of companies that they work for going into furlough. You had all of those issues at play. And so the key thing was that I made myself available at all times to anyone who needed it. And we also had independent sort of counselling and support available too. And I think it's important to stress the people aspect of the response. So in terms of the actual approach that we took to the pieces of work coming through and how we would assess them from a security perspective, we took what we call a light risk assessment approach to solution designs. And our focus was really on 4 key things. So change. Was change going to be managed carefully and risks to service disruption minimized? Do we have rollback plans in place? It's the most common cause of disruption is actually failed change. So we were very careful to make sure that anything that was going to go into production had change impacts considered. Capacity. So again, what are the implications for bandwidth, compute, storage, licensing? Availability here is the key driver, and so for things like Zoom, they consume bandwidth. Teams consumes bandwidth if you enable the video component, so we had to look at those very carefully. Support, so what's the service transition plan? Can we support what's being proposed? Have user comms been put in place? What are the support processes? Have we updated knowledge bases? Do the frontline and support staff, have they been trained? Do they know this is coming? Could they support it if they needed to? And then of course, security across all of that. What are the security risks and implications of the solution? Can we mitigate and control in the short term? What are the essential controls that must be done? And what could we pick up later and accept as a risk at that point in time? So we were capturing the immediate requirements from a security point of view. For example, you must have multi-factor authentication if you're publishing something to the internet. And what were the future remediation or decommissioning requirements? For example, implement end-to-end encryption, or do a penetration test, or catch up with the paperwork. Essentially, those were all things that could be done after you went live, if needed in certain situations. At the same time, we were monitoring the threat landscape. Email security became a major focus for us. There was a huge uptick in phishing attacks, and we were actually the targets of a very sustained, targeted phishing campaign, which took probably a couple of weeks for us to fully contain and resolve. We implemented increased monitoring and alerting and made sure that any threat intelligence feeds were regularly checked and updated. We did additional communications with our users to be aware, be alert, don't click on things. Vulnerability management was also a key priority, and so responding to threat intelligence on known exploits as soon as possible, particularly on endpoints, was a key part of the strategy. And also the metrics and reporting was key. You know, getting data and intelligence on incidents and events and dashboarding those to inform decisions and response tactics was also key. We definitely saw the use of COVID-19 as a lure in phishing attacks, and there is certainly increased risk from people accessing networks from home, unsecured home networks and devices. We're now moving into sort of what we call a recovery planning phase and cycling back. So from a security perspective, you know, remote device management, cloud and M365 security controls are being revisited. Secure remote access and network security are going to be key priorities for future planning and remediation. Improving visibility is going to be another. And so detection and response and building cyber resilience is our objective. We know we can't stop everything, but we want to make sure that we can catch things early, respond and recover fast. We're fixing and catching up with the things we captured in the risk assessments, fixing the things we need to, and starting to reprioritize based on the new models of clinical care. So certainly telehealth and the push into cloud is important, and also catching up on things like pen testing that needed that didn't get done immediately, but is being followed up. Active Directory integrations and all those sorts of things that we allowed through under the circumstances. And I think from a kind of lessons learned perspective, you know, yep, we can operate and run the region's IT remotely. Our office was literally empty. Over 500 people supporting the region from home. Cutting out the governance and trusting people to do the right thing got things done a lot faster. In addition, I think, as I said before, people needed that support from a health and well-being perspective. The isolation, the long hours, we were working 14 to 16 hours, 10 straight weeks, 7 days a week, that takes a toll. And I think now, future scenario planning, what if we hadn't beaten the virus? What if the virus had decimated our teams? How would we cope in that scenario? And that's still a possibility, I guess, if the virus gets out into the community here. So it's not over yet from our point of view. I'm going to do a bit of a pivot now and just sort of start to look at some of the drivers of cybersecurity risk in a post-pandemic world. And then I think we can turn to some of the strategies that you can follow to be a bit more resilient, and the approach that we're taking here in the region. So as we accelerate towards rapid digitization, unequal access to technology, a lack of a global sort of technology governance, coupled with cyber insecurity, is going to create significant risks. And amid a push for greater remote work and digitalization, there's also going to be heightened sensitivity towards health data, data fraud, the potential breakdown of IT infrastructure and networks. I think we will see some major breaches in the next 6 to 12 months as a result of that sort of shift to home working and the risks, increased risks that brings. And while we've got technology-aided sort of COVID-19 responses like tracing apps, the use of AI for vaccine development, you've got pooled computing resources to enhance research. They're all positive, promising things, but again, without that global governance framework to address related risks, that's going to open up vulnerabilities that can be exploited. And overlaid on that, you've then got geopolitical risk and fragmenting global alliances, which allow nation-state actors to come into play. even more. So cyberspace has become a fifth dimension of warfare, if you like, in terms of land, sea, air and space. Small scale cyber warfare is already occurring on a daily basis, and that's not just because of COVID, it's been around for a while. And countries are now increasingly vulnerable to attacks that target strategic assets and infrastructure, and health would be one of those. You've got the economic growth of countries in the sort of global south, of China in particular. These are all challenging the dominance of the West. At the same time, you've got nationalism and populism shifting in some countries, changing their foreign policy objectives away from cooperation. So you've got multipolar, multi-conceptual world, and ideas about how to sort of cooperate and look after global affairs have been replaced by a sort of diffusion of power and political values. So in that fractured landscape, COVID-19 really puts another layer on top of that, and there's just going to be an increasing likelihood of conflicts which could be played out in cyberspace. And then we have cybercrime, and COVID-19 is also proving to be a boon for cyber criminals and fraudsters all over the world. Global COVID-19 campaigns include lures themed on, regional health authority impersonations, fake vaccinations, purchase of personal protective equipment, employee targets, spoof from HR, medical and pharmaceutical supplies, and even false job promises. We've seen a few of those, people being offered jobs on behalf of DHBs. It's just people trying to con people out of money. And that really shouldn't come as a surprise. Criminals have proven highly adept at exploiting a crisis or a global event. And you've got a digital ecosystem where the risk of getting caught is very low, but the potential returns are extremely high. And so the profits from those activities just allow for continuous improvement in their capabilities that will always, or more often than not, surpass the investments made by governments or corporate victims. And then as the economic fallout of the pandemic plays out, I think there will be an increasing number of people who will be turning to online crime as a way of earning money and putting food on the table. They lose their jobs. If you just kind of think about that, they become more susceptible to being recruited into criminal activity. And so I think there will be an uptick in online crime as well over the next 12 months to 2 years. So in that context, then, you need to understand your threat environment. 25% of all data breaches that occur each year affect hospitals and healthcare facilities. Crime and malware as a service is on the rise. The number of threat actors is increasing. The health sector is an attractive target. It's got large volumes of sensitive data. And there are many actors who are motivated to attack the health sector. On top of that, you've got limited budgets and a hesitancy to move to new systems so you've got a lot of outdated legacy systems. You've then got cloud first policies over the top of that, often not properly established and set up properly. You've got the Internet of Things, which is also going to create opportunities, certainly for improved patient outcomes, but with it comes risks of actually more serious and central events in healthcare, as more devices critical to patient outcomes get connected to networks and are exposed. You've got more than 77% of organizations don't have a cybersecurity incident plan or response plan. We live in an age where security prevention is not enough. You have to be able to respond to almost the inevitable. And as you move up the maturity stack, you're moving from a strategy based around prevention to one of detection, incident response, implementing more proactive controls, and putting in place more formal policies and processes. If if you do it right, DevOps can present an opportunity to reduce security risk, but small packets of work should make security requirements easier to identify and bake in. And you can actually automate a lot of that. But if it's done badly, it presents a threat to any organization. And it's often an excuse to ignore standards and be sloppy with documentation and controls. So looking forward and summarizing all of that, the consequences of the shift to home and remote working, I think, will be increased successful attacks in a few months' time. There'll be a fair few organizations who've been compromised as a consequence. Geopolitical threats are likely to increase as countries seek to secure supply chains, and health becomes critical infrastructure in a pandemic. If you can't respond to it, then you're in a bit of trouble. And as the recession and depression bites globally, more people could be tempted to the dark side and become money or reshipping mules. So an uptick in cybercrime is highly likely, and therefore there's that need to invest in resilience, because healthcare systems will be targets for that. So what can you do? I'm just going to outline to you now how we are starting to approach security strategy, and it's strategy for resilience. Now, the key premise of this section is that all organizations need a systematic and proactive approach to information security. You've got threat actors, attack vectors, and IT system complexity that are changing quickly and constantly all the time. And that change and speed of change in large and not so large enterprise environments, where you've got the rush for new technologies combined with sometimes uncontrolled IoT, legacy environments, coupled with the proliferation of low-cost hacking techniques, the expansion of criminal and nation-state motivations from not just financial, but now to social, political, or strategic objectives, has really resulted in organizations facing major security risk. And again, in that context, every organization needs a strategy, a security strategy, to protect its systems and assets, to minimize any negative impact on the achievement of their business goals. But there is a problem, and that problem is that with many security strategies is that they're often vague or nebulous or too tactical and granular. And there's often a disconnect between business managers and leaders on the one hand and the IT team on the other. And the consequence of that is that either the business people get it, but the technologies have no idea how to make it happen, or technology knows what they need to do, but the business leaders just go, meh, it's not an issue I understand, and therefore I'm not going to bother about it. So fundamentally, a security strategy needs to address the following questions. What's the business trying to achieve? What are the risks that will impact achievement of those business goals? And how are we going to address them? And this is how we're starting to do that in the region here. On the left-hand side is our information systems strategic plan, goals and objectives. We have a 10-year sort of horizon broken down into three separate horizons. And these are the objectives of that strategic plan. The risks that may impact achievement of those objectives are in the middle. Okay, lack of resilience, acceleration of digital healthcare projects before we're kind of capable of operating and managing and securing those systems. You've got emerging technology risks, risks in your supply chain that you need to manage. There's the risk of cyber attack, data breach, regulatory and reputational. So you need controls to manage and reduce those risks. And that's the sort of control framework that we have started to develop from a security perspective. When you're communicating with the business, you need to expand on those risks. When you're talking to executives, you need to put those risks in business terms. So we know all these risks are bad. Here is why they are bad for the region, why they will impact our business, or why they will cause problems for us. Because you need to identify your own risks based on your own context, right? But if we just pick up sort of one of those, lack of resilience in critical systems, you know, if we don't pay attention to resilience, we won't be able to recover in case of outages, resulting in impacts to patient safety, patient outcomes, lost income and downtime. You need to connect these risks back to your business objectives and back to the objectives of the clinicians in the business. Patient safety is a key critical factor for them. Patient outcomes is a critical factor. If you can't operate, you can't deliver. And that's the key connection that you need to make when you're sort of selling this to your executive. And this is our, I guess this would represent our one-page security strategy, or a strategy on a page, if you like. The purpose, setting out the purpose, the vision, and the guiding principle. So now we agree on the risks that we need to address. Here are the mission and vision statements for our security risk management program. This is the story that you're going to be telling to people. And these are the principles and objectives that will support our efforts to manage the risks. We do these things on the right-hand side, shifting over to the left, to achieve these objectives, so we can help manage these risks so you can achieve your goals, is the key message that you're trying to get across. And for those of you who might have some knowledge of security, in the middle there, you'll see how we started to relate a security framework into the response. Identify, protect, detect, respond, recover is the NIST cybersecurity framework. The controls on the right-hand side there are actually the concatenation of the Center for Internet Security's controls. From there, we can develop service towers and domains that are going to lead to a catalog of services so we can provide back to the business. Governance compliance, risk and opportunity management, security architecture, and security operations. I'll not go into too much detail there. Again, these come back to the controls. They inform solution design. They allow us to measure how effectively we're managing security across the estate. They enable us to develop technology investment capability roadmap. And at the same time, we're starting to try and make security more consumable and understandable for the wider business. There are layers below this. There's an awful lot more detail, and complexity that forms essentially what is a cybersecurity framework that's been agreed on by the business. And just to give you a flavor of the hierarchy, we have regulatory requirements imposed by the government in terms of the Privacy Act, Health Information Security Framework, the New Zealand Information Security Manual, which is a New Zealand government requirement. That feeds into the controls and the framework, and we also then tie back into our corporate risk management frameworks. From there, you can create a conceptual state in terms of the security domains. And we've linked the controls back to those domains and those service towers referenced earlier. And that then leads to capabilities. And now you can build a roadmap based on the priorities, risks, and current maturity state across those capabilities. And you're connecting the governance and risk through to your operations. And this is how you can integrate security risk management into the business, right? On the left-hand side, you start with a security risk assessment. You do an upfront security risk assessment at the feasibility stage of technology projects as part of the overarching business transformation method. From there, you identify the key controls that need to be incorporated into design through to operations. So if you don't build in the right use cases for, say, logging and monitoring or alerting, then how will the operations team know what to be worried about? Actually, if you take this approach, it's cheaper and more cost effective in the long run. Too often these issues are picked up at the end rather than at the beginning of a new solution. what happens then is you get technical debt as well as increased risk. And if you do that upfront assessment, your total cost of ownership should be reduced, your speed to delivery should be reduced, risk is reduced, technical debt's reduced, your business resilience is improved, and security is actually becoming an enabler, not a blocker to doing things. And finally, just to round it all off, that feeds into a security architecture roadmap, which can be aligned to both the framework in your environments that need protecting. Now, this is an open source model that we're adopting and adapting. This isn't actually our true state. This is just a model and an exemplar of how you can start to connect your controls back to your environments and what you need to do. So hopefully in a very short and compressed period of time, that's provided you with some insight into how to start the process of developing a security strategy and a roadmap for the establishment of capabilities to integrate security into the business. I'm very happy to take questions on that now, but there's a lot of work that goes into the development of that framework. It's then a challenge to get it rolled out to the business, and that will require resources and funding, as well as education and awareness that these things are important and need to be thought about, right? So I think the key mind shift you need to make is that technology solutions are not security. Just because you've got, anti-malware and endpoint protection in place, you haven't done security. It's actually a people, process, and technology challenge, and the people and process piece are actually the most important bit. The technology is actually the easy bit. Thank you, Nikki.
Great, thank you for that. So I see that there is one question that Malcolm has put in the chat. And on top of that, I received a question prior to the start of this session. So the first one is, what would you say is the major challenge to cybersecurity as increasing amounts of data is now being held in laptops out of workplaces as more people work from home? And then do you also have advice for staff working from home on how they can be more secure in their working?
So the major challenge to cybersecurity, if you are working from home or remote working anywhere, is the fact that people may be accessing your corporate networks and corporate data from unsecured home networks, potentially unsecured BYOD, bring your own device, unmanaged devices. You haven't always got visibility of what's happening on those devices. You've got potentially no means of patching them. You've got no means of updating anti-malware. There's a whole host of threats and risks. And then, of course, those people will be being targeted with phishing attacks and campaigns, and potentially you haven't got controls in place you haven't got layered defenses in place that you might have on premises or in your own environments that would help to mitigate those risks. So that's the kind of major challenge, really, is how do you address all of those things. Advice for staff working from home, how they can be more secure: just don't click on stupid links. I mean, that's probably the biggest, the most likely vector that organizations will be targeted through is going to be the people, and it's going to be through email and phishing attacks, and people then clicking on links and being tricked into giving up their usernames and passwords. So train your staff into how to spot phishing attacks, train your staff in terms of resisting on clicking on links if they're not sure, train your staff to verify who the sender is when they get those emails if they're not sure. That would be the first thing. If you have your own device, keep it patched, keep it up to date. Get some decent anti-malware on there. There are plenty of free solutions out there. I can think of Sophos as one where you can just get really good grade anti-malware solutions on your device. There are others out there as well. And just be more conscious when you're working remotely in terms of security. Don't use the same password for everything, and make your passwords complex. Use a password manager. There are, again, free things out there where you can save all your logins and only need to remember one, but you can have a different password for every login account. So those would be the key things. And if you're looking at it from a security strategy perspective, secure remote access is what you need to be looking at. And you need to combine that with potentially things like cloud proxy services, cloud access security, brokerage systems, and how you publish applications either from on-premise or how you make software as a service type applications available to your staff. And there are solutions out there, for example, like Zscaler, that would do those kind of things.
That's great. Thank you, Richard. That's given us a good few options in terms of how to protect ourselves more from home. Another couple of questions in the chat. Is Zoom, when licensed now, considered fully secure for clinical work? Malcolm asks.
Look, nothing is 100% secure. Don't, anybody who says it's 100% secure, it's not. They're telling a lie. Don't buy from them. But if Zoom is properly architected into your environment, and by that I mean integrate it with your Active Directory, set up user groups. You can then apply different controls for different types of users by policy across the solution. Now, that might mean that in some clinical situations you have to relax some of the controls, but on the whole, I would say it's a pretty robust solution if you get the basics right and you manage it and govern it properly.
Great, thanks. And another question from Monsi is, what's the scale of the workforce and skill mix required to make this work? I'm not sure specifically what this means in the context, but perhaps you can outline if there's a generic mix.
Yes, I will always say I've never got enough resources, right? But I would say it's actually the skills that you need to focus on more than the scale. If you've got the right skills with the right people in place, you can do an awful lot very, very quickly. I would say you need an enterprise security architect, somebody who really understands how to connect the security strategy back to the organizational strategy. You need delivery people, project managers who understand security, security architects who know how to design security into solutions. You need good operations people. Now, some of this you can outsource, right? So, it doesn't have to be an in-house thing. I would still say that from an operations perspective, you can't outsource everything. Your managed service provider is still going to need people to help them deal with incidents and events. So in our case, we're a region supporting over 30,000 users, a huge infrastructure. I've got a small team of specialists, three specialists. I've contracted in security architects to help with some of the design phases here. Our operations team is about 5 dedicated engineers and a cyber intelligence center manager, a security operations manager. I have a vulnerability management team, so I've got a vulnerability manager and a couple of pen testers. So we're not a big team covering a very large estate. We always do with more resources, but you can cover a lot of ground if you get the right skill mix.
Great, I think that answers that question. And David asks, do you think there is good understanding of risk at leadership level and appropriate investment to manage this?
That's going to be something that you have to kind of answer organization by organization, and will depend on the maturity of enterprise risk management, I think, in every business. If I take our own environment, I'd say we're on a journey with enterprise risk management, and it's about improving and increasing our security. 3 years ago when I started, I would say the level of understanding at the leadership level was low, but they were curious and they wanted to know more. And you take people on a journey. You have to educate, and you have to talk in board speak to these people. If you go in with technical descriptions of risk, and you go in with, I never talk technology when I'm talking to a board. Never talk technology. It's all about the business risk, and you, if you're in the security space, need to be able to translate security risk as much as possible back to the things that executives will understand, which is, in a health setting, patient outcomes, patient safety. They do understand that, and if you can connect it back to that, then I think you're kind of more than halfway there. But yes, it does need investment, and it needs time and education.
Great, thank you. And Monzi also asks, to what extent are staff being trained formally, re the aspects you mentioned about phishing scams, etc.?
Yep. So we utilize a phishing training platform, and we routinely send test emails to people. There is a training course built into that, which everybody takes. And then we regularly retest to try and catch people out, and gradually the level of difficulty, the level of obviousness of the type of test email gets harder over time. But it's a constant thing. But there are solutions out there that will enable you to do it and automate it. And the key thing is with those kind of platforms is you can measure progress. You can do a baseline before you do the training. How many people clicked? What's the percentage of people who clicked before the training? What's the percentage afterwards? And who are the people who, despite doing the training, still click? Because then you can start to take some targeted action and actually maybe do some one-to-one stuff with them.
And in relation to that, Malcolm notes that one lesson that you outlined was to reduce governance and just trust people more. And he asks, how does that square with the increasing threat to security?
Yeah, it does sometimes cause attention, but I think it's really about how do you adapt your processes into that way of working. Okay, and we need to change the mindset from security being a blocker to security enabling. And if you get the right solutions, security enables the business. It's a bit like brakes on a car, right? Brakes on a car don't slow you down. They actually allow you to go faster, if you think about that. And that's how you need to think about security. Security does apply brakes in places, but it actually enables you to go faster as a business if you get it right.
Excellent. Well, thank you very much. I think that's sort of us at the end of time and conveniently at the end of the questions. I see that there's a lot of thanks to you, Richard, on the chat there. That was really, really helpful getting your insight, especially on those questions at the end. So I'll start to close the session now, by saying thank you to everyone who's joined us this morning in London, this evening in New Zealand, and thank you to Richard, who's kindly presented a really fascinating session. So we'll now close, but an audio recording of this webinar will be available on our website and YouTube channel. So please keep an eye on emails and social media for details of when that goes up and for details of the next LHSN webinar, which again will cover an element of cybersecurity in healthcare, and that's likely to be taking place in mid to late September. So once again, thank you to Richard and thank you to everyone who's joined us today.
And Nikki, can I say, if anybody kind of wants a copy of that, then I'm more than happy to provide one if they email me directly. I just need to.
And you can see everyone, Richard's kindly provided his email, which is on the screen there. I'll leave that up for another minute as people sign off. So yeah, please do get in touch with him if you have any additional questions. Thanks again, Richard, and thanks everyone for joining us.
Thank you.
Goodbye, have a good evening or rest of the day, depending on where you are.